Alexis, welcome to the Nurse Wellness Podcast. This is our special edition called The Pathway into Nursing, our PEN segment. Thank you so much for being here with us. This segment, we really target our student nurse listeners because we know that you, along with many other experienced nurses, have wisdom that you can pass along to our aspiring nurses. So thank you so much for being here.
Absolutely. Thank you so much, Wendy, for having me. I'm excited for for our podcast today and to have a discussion.
Yes. So let's start off by you telling our listeners a little bit about yourself.
Absolutely. So I'm Alexis Akins. I've actually been a nurse for about 11 years. I was a respiratory therapist for 5 years prior to branching into nursing. I'm now a hematology oncologist nurse practitioner for the last 3 years. And I'm now pursuing my doctorate degree for the last year. So a lot going on in my world. That's a little bit about me.
That's a lot. That's a lot to unpack. So what made you go into nursing? So you were already in the healthcare field, you were a respiratory therapist. What made you transition over to the nursing profession?
So you know what is ironic, because I initially applied for a nursing program prior to going into my respiratory program. But what happened was it was extremely competitive. There were not enough seats. So I did not get selected for this particular nursing program. And so I received a letter, I think that next week, saying, unfortunately, we were out of seats and we would love for you to try to apply again next year. And then I think a week later, I received a letter from the respiratory program at this particular university saying, hey, you're great. All your prerequisites, classes were good. Why don't you try out our program? And so I initially tried to get into nursing first prior to respiratory. And so I ended up going into the respiratory program and then loving it, and then working as a neonatal respiratory therapist in addition to adult. And what ended up making me make the transition to go back into nursing and to pursue nursing was just the need to just diversify, my skill set. Respiratory is such a specialized field. And I just saw myself after about 4 years thinking, like, what else can I technically do with this? The level of career trajectory in that field is very limited. And so really aspiring to at some point, be able to have more opportunities for growth is kind of what drove me back to say I need to actually reconsider going back into the nursing field.
So that says a lot about you, someone who did a whole program as a respiratory therapist and then still transitioned into nursing, because we know, because we're both nurses, the nursing curriculum is not a piece of cake or a cakewalk, like I like to call it. So what was able to kind of keep you on track when you were in this nursing program after already doing the respiratory therapist program, going back in to do nursing? What kind of kept you sane, I guess is the best word to use?
If I'm going to be 100% honest, it really was prayer, because when I decided to go back into nursing, I had a 3-year-old child. I was working full time as a respiratory therapist overnight. The program that I was going to was full time during the day. And so I sometimes was getting off of work because the hospital that I was working in was a block away from the university I was attending. So I would literally get off of work at 7 a.m. and walk around the corner and be in class at 8:30 and be there all day. And that went on for 2 years. So I probably think I burnt out at probably the first 6 months. And then I realized, like, when I got off of work, I would go to the chapel actually inside of my hospital and just pray before I went around the corner. And I started kind of adding that to my routine. In addition to, I had great support. Like at the time I was, my husband was extremely supportive. So he was doing a lot of the drop offs and pickups with our daughter, because I would not have been able to have done that without him really taking up the slack, at that time. But yeah, it was definitely not easy and very challenging. That was a challenging 2 years.
Well, so you had so many different factors, but I think you bring up a really good point about, I call them anchors. So what anchors you to keep going? So I know you said you wanted to diversify your skill set, you wanted to have more opportunities, but what was your why? I mean, working nights, getting off, going to the chapel, going to class, got a 3-year-old, got a husband, you got all these things going on. What was the why? Was it really just diversifying your skill set that really kind of kept you going? Because you could have just said, I'm done with this. This is too much.
You know what? I think at the time, my why was seeking a better work-life balance, seeking to have more autonomy over my life and my career, and seeking to have like one day a life where I, was able to attend different things that my child was involved in, or I could have more of just ownership of my own life. Sometimes, working in healthcare, the work-life balance is extremely challenging. And so I think that anchored me a lot during that season. I was on night shift for about 4 years or so preceding that. So I'm like, I can't do this for much longer. I can't see myself at 55 or 60 or however old working night shift, or just the things that you miss, always living in a fog to a certain degree,
Oh, yeah.
So those were things that I think anchored me at that time, just really desiring autonomy over my schedule and my life, to really be able to make my family a priority, because it's hard to do when you don't have autonomy over your life, your work schedule.
Yeah, I think that's so important for our listeners out there. It's important to understand your anchor, because it will get hard, right? Multiple times over, but understanding why you're doing it and not to give up, because that anchor will keep you going, right? Like Alexis working, like that is insane.
I couldn't do it now.
But I think you get into that mode, because when I was in school, I was actually in school in Connecticut, and I was working in Massachusetts. So I would drive back every weekend to go to work in the ER as a CNA, a certified nursing assistant, and drive back.
Yeah.
Yeah, and I don't know what, but I think it's really the why. It's really, you want this so bad that you're willing to do anything, like, you sacrifice. That's really what it is, the sacrifice.
Absolutely. Absolutely.
And now that you are a nurse practitioner pursuing your doctorate, was it all worth it, I guess, is the question.
I'm still in that place. Some days I do struggle with that. Some days I'm like, is it all worth it? But truth be told, I really do think it is. Oh my goodness, this has been such an amazing journey. I mean, I have learned so much about myself that I never, ever would have known, not being on this path that I've been on, and even being able to challenge myself. Like, as you're going back to school, you start to realize, like, as I was thinking about this conversation, you start to realize, wait a minute, I'm in a place where I'm the only person that looks like me, that's career wise, that's in these, in the academic areas, and so sometimes it creeps in, like, do I deserve to be here? Like, is this where I'm supposed to be? And, you have all of those things, and that's sometimes hard to push through. And so even now, as I kind of think about it, even in my doctoral program, I'm kind of like, wow, like there's been so many different challenges that I've had to push through physically, mentally, to be able to be at this place. So I definitely think that it was worth it. It's hard. It's definitely not easy. And no, I definitely don't regret, because even being a respiratory therapist has created so much more clinical diversity that I've brought to the table as a nurse. So I don't even regret that part of my life. I feel like that was a great intro to even healthcare in general, and learning how to own my craft in what I'm doing. So no, I definitely think it was worth it. Was it a long journey? Absolutely.
Yes, yes. And you brought up something interesting. You said you're the only one. What do you mean by that?
So absolutely. When I went, so the first program I did as a respiratory therapist was at a community college. And community colleges, of course, have very diverse clinical, like student populations. So I did not feel as a minority there. But when I decided to go to, different universities, in the nursing program, there were not a great deal of minority students or faculty. So a lot of times there's certain things that creep into your mind when you are a minority in certain universities. Like, do I deserve to be here? Am I smart enough? Is this going to be, am I welcomed here? Like, there's so many different facets that can also creep in. I am glad that when I went for my baccalaureate degree that I was older. I was in my high 20s at that time. I had a better understanding of who I was. Because if I would have entered that environment in my young 20s, it would have been challenging for me to kind of walk through and navigate. So, and then even my master's program was actually, it was very diverse, which is also something that's not usual. But so I didn't have it there as much. But I do, but even when you enter healthcare, when you are a nurse, minority nurses we are the minority, long and short, if you go to different magnet hospitals, larger academic settings, you will be a minority on your unit, in different groups that you're involved in. So it is something that you do have to become quickly acquainted to and be able to also really speak to that in your own spirit and be able to really attest to your feelings about that and talk those things through at times.
I'm so happy you brought that up because as an African American nurse myself, I went to a predominantly white school in Connecticut, a private Catholic, all girls white school. It was a college at the time in Connecticut. And when I came on campus, I struggled with that as well. I was the only Black nursing student. And when I came on campus, it was this thing known that no one of color gets through the nursing program because it's so hard.
Wow.
So when I first came, I was kind of like, oh, well, God, I did say I want to do nursing, right? So I really had to use that as fuel. That really was my fuel to say, I'm doing this.
Absolutely.
I'm doing this. And I remember even having conversations with professors who may have said things, not may have said things out of left field about Black and brown people in the class, forgetting that I'm the only Black person in the class, right? I had to go have those conversations with professors. So I definitely know what you're saying. But I felt like for my 4 years, that was one of my whys, because I was told that I would not be able to make it through the nursing program. And then you bring up another good point about, launching out into the workforce. There are not a lot of, Black, African-American, brown nurses in healthcare. That's why the National Black Nurses Association, such a great organization. And I think you brought this up earlier, being connected is important. Because the color of your skin does not determine your impact.
Absolutely.
Does not determine your worth.
Absolutely.
We all did the work, we all belong, we all have something to contribute. So I think that was such a great point. Thank you so much for bringing that up. And I want to dig into something else about imposter syndrome.
Absolutely, yes.
Talk to me a little bit about that, because I think people see us, you went through nursing school, you have a master's degree, you're working as a HEMONC NP, like that's crazy. That's like well, I'm also an oncology nurse practitioner, so I know that's a hard job, right? It's a hard job. But again, like, and you're about to become a doctorate prepared nurse. I mean, like from the outside, like, wow, you got it going on, right? But talk to me about the imposter syndrome, because it's real. It's real. So talk to us a little bit about that. First of all, what is it, and how have you experienced it in your career?
Absolutely. I think it's so ironic because the imposter syndrome it's something that typically happens I would say for me, it happened when I made the transition from being a nurse to a nurse practitioner. Now I am in a provider role, and you almost feel like you shouldn't be here. You feel like, oh my goodness, they're going to find me out. They're going to know that I don't know this, or so you kind of walk around sometimes with those levels of insecurity, because of just feeling like you're going to be found out. Like, at some point they're going to realize you don't know X, Y, and Z, or you're really not, suited for this position. So for me, yes, it definitely started when I transitioned into the provider role at my healthcare institution. It was not. So I think too, it's twofold. When you also are a minority in a position, it started even for me on the interview process, because I was being interviewed for my current role, and I'm looking at the HEMOC, their picture of all the nurse practitioners within this hematology oncology department. And there's about 50 to 60 nurse practitioners in this picture. Everyone has their white coat, everyone's standing, they're happy. And the first thing I really noticed was there's one African-American woman and out of these 60, there's maybe one Latino woman, one Asian woman. That's the first thing that, of course, drew my attention. And so then it started for me then, as I'm sitting there interviewing, again, how am I going to be perceived if the department is not diversified in this way? Because the patients are not used to seeing people of color in these roles. So it's not always about even how you're perceived by your colleagues, but also how are you going to be perceived by the patients you're caring for when they're not used to seeing minorities in leadership roles. So that's kind of where it started. The one thing I can say that really helped me work through this process was I really had a large amount of clinical nursing experience when I entered this role. And it really helped bolster my confidence in what I was doing. So it was not a role that was extremely foreign. I worked with a lot of autonomy when I was an ER nurse, as far as, seeing these patients, caring for these patients. I was extremely confident in just even my patient interaction, just the bedside manner. And so even what I may not have known clinically at that time, I was still confident in myself and say, you know what, I know what I don't know. And so I was able to seek out different mentors at that time, different people to talk with, how do you guys do this? How does this work? And I think that's also a part of what helps you through that imposter syndrome, is really finding a mentor, finding a trusted colleague who you can really debrief with, you can talk through the process with, and really just helping you along the way. Because even when you are confident in your expertise, you still need that camaraderie. You still need that, girl, you got this, you know what I mean? You still need that just to be successful, because it's hard. Our healthcare, you don't come home and talk to your family about, what you go through, right? Only people who really know how to identify with you are other healthcare providers. So it's good. I think that helps, making sure you have a great mentor, someone who's a trusted colleague who you can confide in, I found helped me a lot with imposter syndrome.
Yeah, I think that's awesome. I think it's important to understand that. Be confident in what you know, what you don't know, and be comfortable with that concept.
Yes.
Because, with imposter syndrome, sometimes you don't ask for help because you don't want to seem like you don't know, but really go in saying, I don't know. But I think it adds an extra layer on being the only or one of two Black nurses or nurse practitioners in the department. It adds that extra layer on, because they always say, they meaning Black people always say, you got to work harder, right? You got to do things better. You got to, you got to do all. So we have all those things we deal with. And I'm saying that because I think it's important for not only nursing students who may be a minority, but also nurses of other, backgrounds, ethnic backgrounds, even leaders, healthcare leaders. It's important to know that your minority nurses or even nursing students may be dealing with different things. So
Absolutely.
consider it.
That.
Yeah, maybe dealing with a lot of different things. And I think that's something that we haven't really talked about in nursing. So one thing, and I'll just share this, and I wasn't planning on sharing this, but I'll share it because since we're on the topic, is I've always been thinking about how minority nurses and nursing students are doing in the pandemic, because our experience is just so different, if that makes sense. And I'm speaking from personal experience, right? Everything that's going on in the world, it hits different. But again, you just have to push through. And I think it brings up the importance of treating everyone as an individual. It doesn't matter what color they are, where they're from, how old they are. Just treat everyone as an individual. Your colleagues, your leaders, your employees, your employers. I mean, anyone you encounter. That's why I'm big on connecting. You have to connect with people so you understand where they're coming from before you can really communicate and understand who they are, why they are the way they are, why they act the way they act, why they talk, So you got to take time to get to know people on an individual level. So I'll just leave that there. And then you bring up mentorship. But you need a mentor. It doesn't matter where you are in your career. Nursing students should definitely have mentors who are experienced in the field for a number of reasons. And people, experienced nurses in the field, should definitely have mentors who are in the field, right? Like you were saying, it's good to have someone to bounce things off of, to, just like, oh, okay. Oh, can you remind me of this? And feel comfortable asking those questions to that person. So definitely, yes. And how do you ask someone to be your mentor if you're a nursing student and you're thinking, oh yeah, I would love a mentor, but like, where do you find one? How do you ask someone to be your mentor?
Well, that's so ironic because I just found that out myself, because that's one of the regrets that I have. I did not get a mentor until literally last year. And I regret, and really truthfully, I think it was foreign to me. I think I just never thought about it up until this point, but I had to get a mentor for my doctoral program. And so I was kind of like, ooh, okay, what does that look like? Or how does that relationships, or how do you ask? And so really what I ended up doing was looking for someone who we kind of had a similar vision. And I also then started speaking with other people who had mentors about, how did that relationship evolve? And I also think not always, you can have the same vision, but not necessarily have to be the same race, right? Mentorship doesn't look like the person looks like me. We think alike. We're best friends. Like, that's not mentorship. That's just another friend. So, mentorship, I think when you've identified someone that is in front of you, like they're already where you may be aspiring to go, or they've traversed different terrain that you're now trying to traverse, that's something where you say, okay, well, maybe I could go to this person. But I think being very concrete and first knowing, what are you looking for? What are you looking to get out of this relationship? What are you looking to do with this relationship? Is this also someone who is respectable? Have you seen them kind of, maybe even sometimes it's from afar, because we live in the social media aspect and everybody is curated pictures and videos. Sometimes you do have to do a little digging up for, about people prior to even asking, because there's nothing like, of course, getting into a mentorship and then you're like, oh, this is not the person I thought, or we're not aligned. So I think first starting with really doing your homework on yourself, then doing your homework on the person. I'm also an adjunct clinical instructor for a university. So a couple of my students have asked me to kind of mentor them. And initially I was, a little bit like, oh, okay. But then I said, no, I want to have some concrete things in place, or else we're just talking on the phone. You know what I mean? And so I think really asking yourself where you're looking to go, what do you, what do you see in this person that you're either trying to emulate or replicate, or, how do your visions align? And then really pursuing them in a way that, of course, is respectable, like, emailing or whatever avenue you have to them. And just reaching out and asking and being very transparent and really direct about what exactly you're looking to gain and what you really, what do you need from them? And then allowing them to set the tone of how your relationship or how you will work in collaboration with each other in that relationship.
Yeah, no, absolutely. And what came to my mind is goals. You need to have your goals in place. Like
Absolutely.
even as student nurses, you need goals, because as you enter and launch out into the workforce, you're going to have goals. Even now, I have quarterly goals, like for my corporate job, right? We go through goals every quarter, right? So I think it's important now to have goals for yourself. And excuse me, not just academic goals, but also your personal goals, like your self-care goals. You want to start those now, right? What are you doing for self-care? So your personal goals with family, your family time, professional, like, do you need to shadow people? What experience do you want to get? And then academic, if you're having, problems in, a class, or something's just not coming easy to you, despite, you passing the test, revisit it, because it'll come back up when you're out in the field. So a mentor can definitely help you through that. So I think it's important, as you prepare for the profession, to get in the habit of making sure you're right in all aspects of your life, not just academic, but hear me again, academic, personal is very, very, very important, especially launching out into the nursing field right now at this time. And I want to talk to you about that, Alexis. So can you tell us a little bit about how you practice self-care now, since, nursing, there's so much going on with stress, burnout, the nursing shortage. Now we're talking about capping salaries. It's like this, there's so much going on in the profession right now. But how do you maintain your self-care during these times?
So my self-care has really, it's evolved. It's not a one shoe fits all category. I think for me now, I've decided in doing my self-care looks like, how can I take care of myself? And that sometimes it can also be very vanity wise. Like I've said, listen, I'm going to go to the hairdresser every 3 weeks. I'm going to start scheduling maintenance of myself. I'm going to make sure I keep up with my doctor's appointments, and I'm going to not allow my family's things to overrun to the point where now I'm not getting my maintenance done for myself. And then also really just taking time every single day. I wake up now, the first thing I think I do is I look at what is the verse of the day on my Bible app. I ride into work with some type of inspirational podcast that I listen to. I've listened now to your podcast, Wendy. Yes. And I think of just every single day doing something tangible to continuously keep my mind in a place that doesn't allow the day's challenges to continuously run over me. And so I find that for me, this is an everyday process, the self-care. It is not like, I do this once a week or I do these things. It's every day. There's something that I'm either making sure I verbalize I'm thankful for, really seeing the good in something that happened that day, allowing myself to live in that daily moment of that. Because I found that prior to this, I was, just you did something you may have got a massage that month or every other week, and you're only now living towards that weekly thing or monthly thing of whatever you decided. But then I realized as the pandemic continued to creep on, this was not going to be enough. Like I really had to continually cover myself with prayer, with scripture, with positive affirmations, and really just thinking through and speaking with people every day that really would encourage me, and really, speak life into me. I couldn't do it anymore, only hanging on to something every month or whatever. So those are like just some of the things I've done that have really been really helping me over the last definitely 2 months, because as Omicron kicked in, my family, we all had COVID, and we were trying to like balance through going back to work, all the changes with, staying home if you're COVID, going from 10 days to 5 days, and all of these changes. You end up like that.
Yeah.
You do. You just
Yeah.
so you have it was so I needed something every day. Every day I needed to continuously really just keep myself in a mindset of peace and harmony, and what things are going to work for me this day to get me through and encourage myself.
Yeah, no, that's amazing. Those are some amazing self-care practices. And these things have to be non-negotiable. I know, many of our listeners, you're, going through nursing, you have, you have it in your mind that you want to help people, but you
Mhm.
have to help self first. And
Yeah.
that's why self-care is so important. You have to help self first. And now is the best time to start practicing that. So I work with nurses and nursing students. And, in the program that I have, I always tell them the first thing that they have to do is you have to put yourself on your calendar.
Yes.
Literally, not like, okay, no, put yourself on the calendar and post it so we can see it. You got to put yourself on the calendar. So I challenge all of you listening, whoever can hear, my voice, put yourself on the calendar at least 3 to 5 minutes a day.
Yes.
And then when you're on the calendar, you can make the choice to say, I'm going to ignore myself when that time comes up, right? Or you can reschedule yourself, but
Mhm.
make sure that you are on the calendar. And that's non-negotiable, because in order for you to fill anyone's cup before you can go out and take care of anyone, you need to fill yourself up first. And
Absolutely.
self-care will not only benefit you, but your family, your patients, your profession, your mental health. I mean, everything. So,
And that's not selfish. I think that's something too that we have to destigmatize. That's not selfish to put yourself on a calendar. Sometimes the world makes us think that that's selfish. Like, you have to put everybody first. And no, your mental health, the way your internal, the way I've just had so many different revelations just over the last 3 to 4 months, just about how, we have allowed ourselves to think like, if we put ourselves first, this is like selfish, and we need, especially as mothers, we need to always put ourselves in the background. But you're so right. When your cup is empty, there you can give to no one. No one.
and we try all the time. We pour ineffectively from an empty cup.
Absolutely.
And that's where stress and burnout and all that comes in. And, one thing that I advocate for, and I hope that more colleges and universities, School of Nursing, will really implement wellness into their curriculum.
Absolutely.
Because our nurses need it, especially where we are now as a profession. Nurses really need to understand the importance of wellness, self-care, and how that's linked to overall health. It's not just about learning the techniques and the science, which is very important, right, to do the job, but really, how do you take care of yourself? Because it's something we don't learn. And like we said at the beginning of this discussion, nursing school is stressful.
Very much so.
I mean, those were the 4 most stressful years of my life. I can remember.
Very much so.
And no one was talking about wellness, stress management, or anything like that. So I think it's important, even, for nursing students to advocate for yourself. You can talk to your professors and your deans about this. Like, what are we doing for our students? You can be that trailblazer. And that's another beautiful thing about nursing is we are advocates, and we think of advocacy in terms of patients and healthcare, but we are advocates for ourselves. Like, a lot of us are advocating right now for nursing, for wages and safe staffing and all these things, but we have so much power as nurses. That's why it's a awesome profession.
Absolutely. Absolutely. 100%.
Yeah. So this was really good. So before we wrap up, I just want to take you through a quick rapid fire, if that's okay with you.
Sure.
All right. So tell me the first thing that comes to your mind to answer the question or finish the statement.
Okay.
One thing I learned about myself during this pandemic is
Resilient.
that's a good one. One thing that I would tell an aspiring nurse who's launching into the field is
Mentorship. Get a mentor. You
That's-
don't, there's so many unnecessarily bruises you have to take when you have someone to help guide you through. Get a mentor.
yes. If I could do something else besides nursing right now, I would be.
Oh, that's a good one. I would probably be a teacher. I don't believe that I would teach children. I think it would be more at the college level, like academic. I've found I've had a real love of teaching that I didn't know I had, prior to this pandemic. Just teaching college students has really been more rewarding than I initially thought when I went in, but having to kind of pivot because of COVID and having to teach in a way that is not the cookie cutter way that was already formatted for us, and allowing me to think outside of the box to help them get scenarios that was very rewarding for me. So yeah, teaching.
Nice. One thing you know now about nursing that you didn't know in undergrad is?
Yeah, I would be a minority. I did not know that. I
Mm,
did not know that.
wow, that's
I,
interesting.
I did not. I think
Wow.
just because of a lack of exposure, I really did not know that I would really be walking in and be a minority in a lot of the jobs that I would be taking. I did not know.
Wow. Wow, that kind of blew me away. But yes, that's real. That's real. And one book or quote or saying or piece of wisdom that you would give to a new nurse launching out into the field is?
Oh, it's actually a verse in the Bible. It's in Luke. It says, "To much is given, much is required." I think that this is a fantastic field. This field, you can do whatever it is you want to do as a nurse. It's so broad. It's limitless, your opportunities as a nurse, but it's definitely going to require that all of those gifts and talents that you've been given, that you will literally be put to the test with all of them. It's going to require a lot of you, but you're going to get a lot out of it, 100%.
Yes, awesome. Well, thank you so much, Alexis, for spending time with us and sharing your story. This was an amazing discussion. Thank you so much.
Absolutely. Thank you, Wendy, for having me.
Absolutely.